Common kidney disease conditions. 1. Why say the first sign of kidney disease is fluid edema? Edema is a common clinical condition of kidney disease because the kidneys cannot normally excrete water, causing water in the subcutaneous organizations among cell organizations to accumulate, causing edema. Kidney edema or renal edema, due glomerulonephritis, synthetic kidney disease, caused by the accumulation of sodium and water to form edema. Characteristics: edema often appear in parts of the body have a loose organization, such as skin, eyelids, cysts. Kidney edema with varying degrees, mild in the orbital sockets or joints, severe in the whole body, legs, chest, abdomen. Depending on the type of kidney disease. For acute nephritis, clogged blood vessels of the ureter, leading to poor filtering of the glomeruli. Therefore, through the feedback effect of the blood capacity sensor, the antidiuretic hormone is increased secretion, the amount of water absorbed through the renal ureter increases. For chronic nephritis and synthetic kidney disease, the process of proteolysis and metabolism is too fast, leading to the loss of large amounts of protein lost through urine. The protein in the blood is low, causing the osmotic pressure of plasma colloid to decrease, causing water to gradually move to the spaces between the cell organization, causing edema. 2. Why does kidney disease raise blood pressure? According to statistics, the rate of hypertension due to kidney disease is the highest, many causes. It is related to the nature of kidney disease, the degree of anemia of the kidneys, the extent of the kidneys' pathological changes and the damage to the function of glomeruli. For people with kidney disease, increased renin leads to hypertension. 3. People with kidney disease may have back pain. There are many diseases that can lead to back pain. When the capsule shell of the kidney is pulled, it is affected and due to contraction that increases pelvic and urinary tonicity, leading to kidney pain. Causes of pain in the kidney area are of two types. Painful kidney pain, often affecting the lower abdomen, outer and inner genitalia of the thigh. When pain can be accompanied by nausea, vomiting, pale face, cold sweating, pain after urination with bloody urine. Most often it is caused by stones in the kidney or by blood clots and dead tissue organs, causing obstruction of the urinary tract. Chronic dull pain in the kidney area, due to pyelonephritis, renal prolapse, kidney disease that causes erection, polycystic kidney, chronic nephritis, often with a slight throbbing in the kidney. 4. Abnormal urination caused by kidney disease? Why urinate constantly? Normal healthy people have good control of urination, they can urinate freely or urinate without feeling uncomfortable. Conversely, if you are unable to control urination, or have painful, burning sensation when urinating, you are urinating abnormally. Phenomenon: persistent urination, urgency of urination, painful urination, incontinence. Urinating urgently, the patient cannot control urination. Must urinate immediately, or immediately after urinating, continue urinating, do not urinate fast, is not timely. Painful urination, when you urinate, your bladder or urethra feel uncomfortable, painful or burning. Severe cases can be painful and unable to urinate. Urinary incontinence, urine is not under control but suddenly flows out. Urinary retention, urine stays in the bladder, without being discharged from the body. If these phenomena occur, most are related to the urethra, bladder and prostate gland. Why urinate constantly? Normal people urinate 4 to 6 times a day, urinate 0 to 2 times a night. If exceeded, is called continuous urination. Causes of continuous urination. Increased urine output, when the amount of urine increases, the frequency of urination increases. In case of illness, like a person with diabetes, the person who eats a lot and drinks lots of water, also increases the frequency of urination. Cystitis, the ability of the sensory nerves to decline, thinking about urinating in a stimulating state, leads to continuous urination. Due to urinary stones, foreign objects. Other diseases such as prostatitis, pyelonephritis, urethritis also appear to urinate continuously. Due to the irritation of inflammatory disease, frequent, urgent and painful urination always occurs at the same time. 5. What is hematuria? Causes? What is hematuria? Hematuria is a phenomenon in bloody urine. The normal person in urine has no red blood cells or only occasionally has a few red blood cells. Because the amount of blood in urine is not the same, there are two types, visible to the eye looking through the microscope. There are three types of hematuria. First, hematuria in the end, complete hematuria. Causes of hematuria due to diseases in the excretory system, nephritis, kidney stones, infectious, damaged. Pathological changes in organs near the urinary tract, inflammation or enlargement of the prostate gland, appendicitis. Systemic diseases, blood disease, vascular disease. Medication, taking anticoagulant or irradiating medicine. Due to activity leads to bleeding. 6. What does excess protein, albumin, in urine mean? The amount of protein in the urine, of ordinary people is very small. Within 24 hours, only about 15 grams, mostly small protein molecules, are formed by plasma proteins, kidney proteins, and some of the urinary tract epidermal cells are excreted. The main cause is still glomerulus, mainly albumin. 7. Why can people with kidney disease have anemia? There are many causes of anemia such as malnutrition, excessive red blood cell destruction, obstruction of the blood-forming function of the marrow, blood loss. People with end-stage kidney disease, chronic renal failure may also develop anemia. Why? Specifically include the following. Malnutrition. As a result, hematopoietic substances, such as Fe, folic acid, protein are not sufficient for the body, leading to anemia. Low red blood cell count. In the final stage of kidney disease, severe kidney damage, the production and maturation of red blood cells decrease, leading to anemia. The rate of destruction of erythrocytes increases. When chronic kidney failure, the body eliminates the amount of waste. During metabolism will decrease, the concentration in the blood increases. These wastes break down red blood cells, shorten the life of red blood cells, leading to anemia. Chronic blood loss. For people with urinary toxicity, waste products and acid sources cannot be excreted from the body. Even if are in end-stage renal failure, click here to try the kidney disease solution risk-free for 60 days. Link in the description. 8. Why do people with end-stage renal disease often experience vomiting? In the late stages of kidney disease, patients often experience stomach discomfort, loss of appetite, nausea, vomiting, abdominal pain, diarrhea, loss of strength, or more dangerously, gastrointestinal bleeding. Gut bacteria produce an enzyme that breaks down urine into amines. Can cause ulcers, lead to nausea, vomiting, bloody diarrhea and even hiccups. Even if are in end-stage renal failure, click here to try the kidney disease solution risk-free for 60 days. Link in the description.